Dear friends, welcome to Know Thyself YouTube channel. Good morning. Hope you are all staying safe and keeping well. I sincerely thank all of you who have subscribed to this channel and follow the channel. If you find the contents of the videos uploaded in this channel useful, please subscribe to this channel and click the notification or the bell icon so that you can be notified when a video is uploaded. Kindly share the videos with others or on the internet. In the last two episodes of Know Your Mind segment, we elaborated on the nature, characteristics, and classification of language disorders. In this episode, we analyze the causes, characteristics, and classification of language disorders. Causes of language disorders. It is estimated that as many as 1 in 20 children have a language disorder, and in many cases, the exact cause is unknown. Despite the uncertainty around the causes of language disorders, certain factors have strong links to their origin and development. These factors include, first, genetics and family history. Persons who are genetically linked to families that have the history of people suffering from language disorders have a greater risk of developing these disorders. Second, birth defects, prenatal and postnatal problems can trigger the emergence of language disorders. Third, developmental disorders such as autism, hearing loss, cerebral palsy, and the like can co-occur with language disorders. Fourth, learning disabilities such as reading disorder, math disorder, writing disorder, problems with motor skills, auditory processing disorder, and visual processing disorder can also lead to the emergence of language disorders. Fifth, brain injury such as blood clotting, hemorrhage or bleeding, concussion, and swelling of tissues in the brain, and other injuries that may occur in the brain due to skull fracture or damage of brain cells can lead to the emergence of language disorders. For instance, aphasia, the loss of ability to comprehend and use language, can occur due to damage to portion of the brain responsible for language, which can be caused by a stroke, blows to the head, or brain infections. Sixth, damage to the central nervous system, particularly injury to nerves such as the vagus nerve, can significantly affect the organs of speech such as throat, leading to the origin of language disorders. 7. Deep emotional disturbance caused by childhood trauma or painful experiences can also lead to the origin of language disorders. 8. Environmental factors such as lack of exposure to conditions that can facilitate language learning, poor upbringing, depriving living conditions, and the like can lead to the development of language disorder. Any of the above mentioned factor or a combination of some of them can cause language disorder in people. Diagnosis of language disorders. The language disorder diagnosis begin with identifying and ruling out conditions such as hearing disorder or other sensory, speech, or language impediments. Hence, the first course of action in diagnosing a language disorder is to have a full physical examination by a medical doctor, and particularly examination of the organs of speech and language by an ENT specialist. Once these problems are identified and ruled out, then a speech language therapist or a neuropsychologist can begin the comprehensive evaluation to assess the condition of the clients. During comprehensive evaluation, the clients may be administered standardized tests and assessments to review their levels of language reception and expression. In the light of these assessments and looking into the case history of the clients, A speech language therapist would find out if there were learning or speaking delay in the clients, if they speak the language expected of their age, if they make grammatical errors while speaking, if they have a limited vocabulary in relation to their age, if they have trouble finding right words, if they are able to understand what is being told to them, and if they can tell their story coherently. With the help of these information, the speech language therapist would be able to identify the exact nature and type of language disorder the clients are suffering from and create a treatment plan specific to the condition of the clients. Treatment of language disorders. Language disorders can have far-reaching consequences on the life of the affected persons, such as poor social interactions, problems at school, at work, in social settings, depression, and behavioral problems during adulthood, such as undue dependence on others as adults. Besides, challenges with the reception and expression of language can lead to problems with comprehending and using spoken, written, or symbolic language. Since prevention of language disorders is not possible, as we do not know the cause until after the symptoms have appeared, it is important to treat these disorders through early intervention. The earlier the treatment begins, the better it is for the affected persons. Treatment primarily consists of speech and language therapy in order to improve the receptive and expressive language skills of the affected persons. It could include one-to-one treatment sessions with a speech language therapist or participating in group sessions. In these sessions, the client would be taught language skills they lack with reference to their age and condition. However, the treatment of language disorders calls for the collective efforts of parents, teachers, speech language pathologists, and other professionals. The work begun with the clients by the speech language therapist or other professionals in one-to-one or group sessions must be continued by parents and teachers both in the home and school settings. Parents and teachers in dealing with the affected persons must speak clearly, slowly, and concisely when asking a question. Must wait patiently as the affected person forms a response. Must keep the atmosphere relaxed to reduce anxiety. And must ask the affected persons to repeat the instructions given in their own words. In short, parents and teachers in dealing with persons affected by language disorders should provide a place of comfort, instill in them confidence, and help them believe that they can truly cope with the language disabilities and move positively in life. In the next episode, we will speak about the third language disorder, namely hearing disorder or HD in detail. Thank you for watching this video. Stay blessed until we see you again with another video.